Good morning, students. Today we are here to discuss the same topic which we have already started from last two lectures. In that, we are discussing education and training of medical staff, for which we are planning various programs. Out of them, we have discussed three programs in last two lectures. Today, we will discuss remaining two types of programs which need to be discussed in this lecture. In that, third program is in service education. What is in service education? In service education is a planning learning experience provided by the employing agency or employees. Is the typical type of short sort of education which has been planned during your job. On job planning has been done for your any small sort of education, any course, any small sort of training which need to be given during your job schedule. It can be planned in 5 day schedule. At the weekend you can plan, or any typical week which we can give for the typical programs. In service education is a planned educational experience provided in the job setting and closely identified with services in order to help person perform more effectively as a person and as a worker. Concepts in service education: closely identified with services. During services, if anything which you can identify that I must learn this thing, I must learn this skill, this technique to improve my work, so you can identify that typical technique, help a persons to improve performance effectively. If you are lacking that techniques, if you are lacking that typical function, typical skill which we need in that work during their functioning, if you have, it will definitely improve your work. Planned education activities: these activities you can plan at typical period of your job. As I told earlier, at each weekend for 6 months or for a few months you can plan, or in a week for 2 days, or on the last day of your week for few hours. In that fashion, you can plan for several hours or for several days, provided in a job setting. Your job setting, your job profile is there. During your job profile you can plan that program, that typical course, small sort of course. It may be regarding computer awareness, it may be regarding learning any typical language, it may be regarding learning or understanding any software, or to develop a knowledge of any instrument, any new thing, any new skill, or handling to the customers or handling to the patients, or any medical sort of devices which you learn how to handle that, or any you can plan that. Changes and scientific advancements. Changes and advancements in the field of service. There are lots of changes occurs in our medical field, and according to the need of medical field, according to the new development which is going on into our medical field, you have to change ourselves, and for that we need these programs. Increase the demand of nursing services. All over the world the nursing demand is has been increased. India is the largest exporters of nursing service. From Kerala and from South Indian states, lots of nursing staff is doing their job across the world, mostly in the Caribbean countries, or in the Saudi Arabia or Oman, or in UK, US, all over the world they are working, and there is high demand of nursing staff all over the world. Consumer demand quality care. Consumers also demanding for developed staff need to be required for their quality care. If well trained nursing staff or medical staff is there, it will give the good quality of service to our patients. Rapid changes in the medical and nursing practice create a need for the service education. Always there is some things need to be increased or added into your syllabus, in your books, so that update knowledge we must have. Increased number of people seeking healthcare as a population enlarges make it necessary for the hospital staff to function at his highest potential as quickly as possible. As healthcare delivery system become more complex, the need for continuous skill training also increase. We need to continuously we must learn the new things from our scientific field or our medical field, and we should implement that knowledge into our work. By that way, we will improve our work. What are the aims of this in-job training? Improvement of client through upgrading the services rendering with scientific principles to keep in phase in changing society to their needs. Acquisition of new knowledge, a bunch of new knowledge which you can implement, you can incorporate, and you can authenticate that new knowledge. You need to be included into your work. Improvement of performance. If you are having that new knowledge, new skill from your new medical field, which has been you have incorporated from the various sources, so it will help you to improve your performance. To develop specific skills required for practices, to develop right concept of client care, to maintain high standards of nursing, because we are competing all over the world. So what is the other countries staff, how they are treating patients, how they are caring patients, how we are giving the medical facility, nursing facility. So in that fashion we need to develop ourselves in that way that we should also able to give that type of facility. To observe and bring change in staff members chances for promotion. If you are giving your full efforts into your job, you must get promotion, and by giving promotion you are encouraging those staffs who are doing their work honestly and very effectively. To reduce turnover absenteeism, by this way, we can also decrease the absenteeism among the staff. To discover potentialities, to alert personnel in working environment. Steps in service education. There are two steps. The first is assessment. Pinpoint needs, prioritize needs, set training objectives. We have to set some objective, what things which we can learn, how we can plan that we can discuss. And priorities, which thing we should learn first. What is a priority? Out of all the courses, which course is very important, which training is very important for our staff, that we can identify. And develop criteria, which criteria you need to fulfill after completion of this program, that also we need to be identified. Next, implementation, climate check, actual conduction of training with ongoing monitoring. Climatic change means the day from which we have started the program, the training or the typical course. From day one, we should check how much the staff is understanding, whether it is really affecting their morale, really affecting on their skill, really they are getting some knowledge, they are upgrading their skill or not. We should monitor the program during the course, and it will help to increase the effectivity of your implementation. And if any lacuna is there during implementation, we can improve it, we can change it. So in this fashion, the various objectives which we can fulfill. Continuing education, it is another sort of or another type of development programs which we can give to our staff. Continuing education is all the learning activities that occur after the individual has completed his basic education. Whatever degree he got or degree or post graduation he got from the educational departments, after that whatever things he is learning, he is during his job or from his hospitals or nursing home, whatever education or whatever information he's gathering, he's acquiring from his senior staff, or from the conventional way, what are the basic goals or what are the SOPs, what are the SOPs of that hospital or that nursing homes, what standard they have set. And during your entering, when you are enter that typical organization, so during your job, what things you are learning which you has been started to learn, that is nothing but the continuing education, the education which builds on previous educations. Need for continuing education to ensure safe and effective nursing care, as nurses need to keep abreast with interest, knowledge and technical advances to meet the needs of population. Because as population is increasing, accordingly we are not increasing our medical or nursing demand, so we must increase their numbers. Because if nowadays you might be aware of that in this COVID condition, hospitals are not sufficient to take care of all the patients, as the patients are increasing progressively day by day, and we have to keep the patient at their home if they don't have their symptoms. So in that case, there is huge demand of nursing staff to take care of patients. So for that, you must give them proper training, you must give them proper education to develop the doctors, pharmacists, and nurses by updating their knowledge and prepare them for specialization. You should develop the doctors, pharmacists, and you should upgrade their knowledge and prepare them for the specialization. So what knowledge in their field, how can they upgrade their knowledge? You must give them Good morning, students. From last few lectures, we were discussing about the methods of staff development programs. In that, we have discussed few methods, and today we will discuss the remaining methods. This is the last lecture on this topic. Today, we will start the new method, that is continuing education. Continuing education is all the learning activities that occurs after the individual has completed his or her basic education. Means after the graduation, whatever specific graduation you have done, it may be MBBS, BAMS, or nursing course, bachelor nursing course, or B pharmacy. So after that, whatever progress you want to do or whatever further education you want to do, that you can do in continuing educations. Means you are doing job and you are learning from your job, you are learning from basic things from your job, and if there is requirement to increase your education, to continue your education, it is nothing but the continuing education. The education which build on previous educations, means on the previous building block we are increasing our education, we are increasing our information of education. Need for continuing education to ensure safe and effective nursing care, as nurses need to keep abreast with interest, knowledge, and technical advancements. So, any job, if you want to do, we must develop interest. If you are having interest in that job, you will do your work very honestly, very effectively, and knowledge and technical advancements. If any new technical things has been emerged, so you must know that new techniques, and we must use that techniques in our work to meet the needs of populations. Whatever the needs are there of populations, if there is large number of populations, you have to give the sufficient numbers of the medical staff to that population, or what are their requirements that we should know and we should try to fulfill to develop the doctors, pharmacists, and nurses by updating their knowledge and prepare them for specializations. We must always update our knowledge regarding the current scenario, regarding the current consequences which are going on, and we should use it for our job. For career advancements, if you will increase your education, if you will update your skill, it will help to do your career advancements. If you will give, it will give you more weightage in your job, and your career will be highlight, your career will be flourish. With the advancement of technology, new role change takes place, and to play those roles education is required. To acquire special skills, for special skills also you have to do some education, continue education, any small sort of course, or if any post graduation if you want to do, you should do that. Due to shortage of nurses, as we know, India is the huge production house of nursing and medical staff. In India, lots of nurses, lots of physicians, lots of pharmacists are produce, are develops, and we are exporting them to all over the world because they are movement to abroad, more hospitals and training colleges. In case of nurses, if we will discuss, so in India lots of nurses are developed, and we are exporting them, lots of nurses from Kerala, from Tamil Nadu, from Andhra. They are more likely to go in Gulf countries. There is huge demand for nurses and medical staff. So in Oman, in Muscat, in Riyadh, lots of Gulf countries, and also few African countries, in US, in European country also, there is huge demands. So that's why there is shortage of these nurses in India. So for that, whatever the staff we have, we should you should update them, you should train them, you should teach them and make them more knowledgeable. Functions of continuing educations: to meet the health needs of public expectations, to develop the practical abilities, of physicians, pharmacists, and nurses to recognize the gaps in knowledge. Because suppose if you have done our graduation 10 or 20 years back, so there may be gap period, and due to which we may forget that concept, that typical knowledge. So our knowledge should be updated. We should try to learn whenever we are getting time. We should try to learn, we should read the books, we should try to get the knowledge which we have get in our degree course, and we should update our knowledge. That's why in some countries, in US or in UK, in European countries, there is examination is there for pharmacists. In each year they have to pass that examination. Also in case of nursing and medical staff also, to recognize the gap in knowledge, to test abilities of participants to do formal academic studies. If our staff member are able to do some next course, extra course, or post graduation, suppose if you want to go for the PhD work, if you want to do any research, so we must encourage them. We have to identify their abilities, and accordingly we must encourage to do post graduation or PhD. If you want to do any research, it will help them to develop their career and also to develop our field. Our field will be improved. To improve the education between participants, faculty, community, and health sector, to shape or support university educational policies and practices. So by doing this, we can help the educational universities how to develop their syllabus, how it will help into our career, how our medical field will be more advanced, more effective to do the service of publics. So we can shape our universities and their educational policies and practices, and to ensure quality of educations. By that way, we can modify the syllabus. What type of syllabus is helpful to improve our effectiveness of our medical field or nursing field or pharmacist field. So we should able to develop that, and for that we should ensure quality education. To grant the budget for extension of studies, we must give funding for extension of studies. If some staff want to do post graduation or they have to pursue PhD, so we must encourage them, we must grant budget, we must give them funding to do their further education. To maintain the academic standards, if we are encouraging our staff to do their further education, to develop them a good skill into education or to any technical skill if they want to develop. So if you are helping them by providing fund or to grant their, to sanction their protocols, so it will helps our academic also to increase their standards, to provide opportunities for educational growth. If you will do that, definitely it will give the opportunities for educational growth, and the students who are getting their graduation, who are getting their degrees, they will also get a good knowledge regarding the medical field or nursing field or pharmacy field. They're getting good knowledge because their staffs are well equipped, they are well knowledged, well educated. So they will also give good knowledge to their students, and in this fashion our academic standards are also standardized and educational growth will occur. To maintain the roles as bedside nurses and to assume more supervisor, means nurses are not only for bedside nurses to do the service of the patients, but also they can supervise, they can be administrative, and to specialize and to generalize the practice. To provide and prepare faculties who see continuing nursing education as a personal responsibility. To provide a variety of continuing nursing education opportunities to high quality to nursing in both education and service changes. We should provide them variety of continuing nursing education. If somebody want to do post graduation or PhD, or if they want to do any another course to develop any skills, to develop any new technique into their career, to sharpen their career, if they want to develop any new things. So we should encourage them. Now, the last point of our development programs to our staffs, we are discussed the various development programs. Out of them, this is the last one, that is training for specific functions. Specific functions we are allowed to do our staff. In the definition, this is concerned with the developing expert technical or manual skills, communications, and help the personnel to perform their functions effectively. So, by developing some expert technical or manual skills or communication, so we are helping the staff to do their work very effectively, very promptly, very sharply. The objectives of this technique is to help the hospital personnel to perform correct methods. We should identify which one is correct. So accordingly, we should perform the correct methods, and we should develop or modify our SOP accordingly and make the correction in our SOP also, and identify correct methods and perform it into the hospitals and procedures and understandings. Establishing standards and quality of medical services. Try to establish the standards, because in medical field lots of malpractice is also going on. So we have to set the standards in India and also in all over the world. We have to set the standards and try to go with your standards, because other organizations also see your standards and they will try to match their standards with your institutes. So we should set some goals for our institutes, for our organizations, for our hospitals. So these are the standards, and we will never compromise to our standards. Procedure to skilled nurses to skilled nurses. So we should develop some procedure, we should develop some courses, we should develop some policies by which we will furnish the nurses, we will polish the nurses from nurses to skilled nurses, because we don't want to increase only number, but also we have to increase the quality of our nurses and other medical staffs. So make them more skilled means there will be more demand in all over the world, and they will be more skilled means they will do their function, they will do their service very promptly, very sharply, very effectively, so that mankind will get good service, and their life expectancy will be increased. Because nowadays a health sector is very very important, because lots of countries are in crisis because their health sector is not that much strong as compared with the developed countries. Even in India also it is not that much strong. So we are still under developing conditions. Lots of developments need to be done in our medical field as well as in health sectors. There are various types of skills that we should develop into ourselves, and we can increase our work function. In that, first is psychomotor skill. The psychomotor skill is nothing but the movement of person, movement, or it is understanding, or it is dexterity, or speed, or tone of your body language, your gestures. Dexterity is nothing but the movement of your hand, fingers, how skillfully you are working. So that your walking, your tone, so that all things, your body language, your movement, it is nothing but the psychomotor skill. So by this way, you can develop your personality, your body language. So how you are looking, how you are walking, how you are giving gestures, your facial expressions. So all this comes under the category of this psychomotor skill. After that, next important skill is cognitive skill. Cognitive skill includes various factors. It includes reading, thinking, after that understanding, remembering, give reasoning, and interpreting the things. So cognitive skill is also very important to understand anything, to develop thoughts, thinking power should be developed, and all these things are required to do your function properly. If you are a doctor, if you are a pharmacist, if you are a nurse, you must able to recognize the patients, recognize their disease, recognize their problems, what are their priorities, we should able to recognize, we should able to understand, we should think, and appropriately we should work on that. So here cognitive skill is also very very important. Teaching skill. Teaching skill includes the perseverance, problem solving methods, and it also includes the hard working, and encourage our students. And the important thing is that whatever concept is in your mind, try to percolate that concept to your students. So it is nothing but the teaching skill. And when you are doing it fluently, when you are doing it very properly, definitely it helps into your job. So teaching skills is very important. Whatever knowledge you have, it don't have any meaning. But if you are able to percolate that knowledge, if you are able to transfer that knowledge into your students brain, if it is reaching towards your students, then it's having some meaning, otherwise it's just useless. So teaching skill is also very important. Next skill is affective skill. Affective skill is nothing but the skill which deals with the attitude and your behavior. When you are changing or you are developing your attitude and behavior, and we are changing that, and when it produce changes into your personality and also in your function, so it is nothing but the affective skill. Means it should produce some effect by changing your attitude and your behavior. Means you should be punctual, you should not be very liberal. So it is called affective skill. And by this it will change your personality, it will change your attitudes. After that, communication skill. Communication skill is nothing but the when somebody is hesitating with you, means you are not having proper communication skill. If every person is free to talk with you, if everybody is not feeling anxious, not feeling fear to talk with you, means you are having good communication skill. We must able to talk in any person in any language fluently, means they must be free to talk with you. It is called a good communication skill. So whatever things or whatever say in your mind, you must able to convey to your opponent, you must able to convey to the person who is in front of you. The same thing happens when you are nursing, when you are being a physician, when you are pharmacist. Whatever you have to tell, you must able to tell to your patients, to your customers properly. They must understand and they must feel free to talk with you regarding any queries, any problems if they are having. So you must able to talk with them. Next is supervisory skill. It requires the leading property and problem solving property and also monitoring property. So supervisory skill is nothing but the when you are monitoring any program, when you are monitoring your staffs, you must able to change them. Your staff must able to listen to you, and you must able to encourage them. If they are doing any good job, try to encourage them. If they are doing not good job, if they are doing any mistakes, in that case you must able to tell them, you must able to show their mistakes so that they will change themselves. So supervisor skill is also very important. If you are a good supervisor, your staff will work very properly and not a single complaint will be arise into your institutes. So supervisor skill also one of the skill which you can develop among yourself to do your function very properly. Now needs for skills. There are various needs for your skill training. In that, individual nurse needed to have greater freedom to choose the specific field of nursing in which she would work. So every person must be feel free to do his work in his area. So we should not bind to any person to work in the specific area. So they should feel free to work according to their will, according to their interest. If somebody is doing the work where they are having interest, they will give their 100%. So we must provide them some area to do their work according to their will. Good work to be recognized and rewarded. This is very very important in our institute, in any organization, in any hospitals, in nursing home. If some person are doing their job in very great extents, in very good manner, so their work always should be recognized. And By not only you should recognize, but also you should hire them, you should reward them, you should place their name in the notice board, you should give their name to newspaper also, that this person have done this very good job, this very good work. By that way, what will happen, it will give the encouragement among all the staffs, among all the staff members, and it will help them to do the good work. That good works are always recognized, and it will get the rewards. If you'll give them some rewards, if you'll give them some compensation, if you'll increase their salary, if you'll give them some increment, if you give some package, extra packages, so definitely it will help their work, and they will continue to do a good work, do good job. And also the other staff will be get encouraged by them, and these persons will set examples among all the staffs, and other person will learn from them. A venue of advancements and promotion need to be better developments. So for promotion need to be better developments, a venue of advancements should be decided for our training. So where we should develop this program, where we can take these programs. So we should identify, and by this way we can have the better development into our programs. And fear for making mistakes, that is very very important. If you are doing any error, if you are doing any mistakes, there should be fear into the staffs. If there is no fear, means they will be liberal to do their work, so they won't do their work very clearly, very precisely. So in case of medical field, small mistake will take a life of a patient. So you are not allowed to do any small mistake also. So always, it may be doctor, it may be physician, it may be any specialist, any surgeon, any clinician, any nurses, any pharmacist, any pathologist, because nowadays lots of malpractice is going on. In case of surgery also, lots of the surgery of pregnant women in their labors, unnecessary surgery is going on. So that type of surgery or malpractice should not be there if it is not required. Nowadays there are lots of companies, private companies, they are giving false result or false report of COVID-19 cases. There are lots of cases like ThyroCare. There are certain prosecutions has been charged for doing these things. So this may happen. So we should not follow such malpractices, because lots of people are there only for earning money. Lots of hospitals are there only for getting money, grab money from the patients. Because for in COVID conditions, lots of hospitals are nothing but they are becoming the earning machines. Only you have to enter into the hospitals, and they will charge 2 lakhs, 3 lakh rupees from the patients. So this is happening actually. But during that, we should not do any small mistakes. We should not do any malpractice, so that we are here to serve people. No doubt we should get our compensation also, but we should serve people very honestly, so that there should not be any mistake in our work. We should always fear to do any mistake, to do any error. So students, here I am finishing this topic today. So for today, it is sufficient. I hope you understood the whole concepts. If you have any queries, you can put your questions into the comment box. Thanks a lot for hearing my lecture. Thank you.